A lot of the energy that Nuci space has been built upon and we succeed on is, that kind of student energy and great ideas and kind of this kind of never say die attitude. And we really have seen that in the medical students. I mean, they're not afraid to ask tough questions. They're not afraid to come up with answers.
This year, they're trying to gauge the needs of the community. So uninsured musicians, uninsured artists, what's out there that they need, what do they have access to, what do they do when they get sick?
From a musician standpoint, some of the health disparities we saw were just like not being able to afford, going to see a doctor, maybe having a lifestyle that doesn't allow you to be able to make consistent trips to the doctor, and maybe needing medications that aren't necessarily gotten through appointments. A lot of times these people are waiting 2 and 3 months to seek psychiatric help, and a lot of times that's entirely too long for someone to go without medications, or and it's hard to get a continuity of treatment for these people.
Our typical client is a working musician who works in town, either in the service industry or just around town, or maybe even just making money playing music, and they don't have insurance, they're not a student. That said, we have younger people, we have older people, we have people who aren't working.
I think because the music scene is so big here, I think understanding that population and kind of how we as students can do, kind of be their voices to doctors to get them good care, I think that's probably what I got the most out of it, just learning about the creative community here and learning what their needs are. And if you had told me their needs were different than any other person on the street, I would say no, but they do have different healthcare needs than other people in the community.
It's difficult paying out of pocket or being self-pay anyways, just in general. And a lot of musicians are self-pay. Like I had a guy that was playing on stage and stepped on a martini glass, and the stem went straight through his foot. And he doesn't go to the doctor. He just makes sure that the bleeding stops, but doesn't go to a doctor, and now he has permanent nerve damage.
There was a musician whom I interviewed who is currently in $50,000 worth of debt from one hospital because she had been having a series of unexplained seizures and had gone to the emergency room each time. However, she was uninsured.
These stories kind of abound in that community because whereas they're making some money, they're not getting health insurance through any kind of company, but they are making money as well. So they're not on Medicare or Medicaid. So it's one of these situations where you're making some money, but not enough to take care of a bill.
I believe that if Athens is a town that really wants to nurture that community, they need to provide a way for musicians to support themselves and their family while they're pursuing that career. If we could save, one person in the hospitals $50,000 through a certain program, and that was just from one individual. If there were 10 people in the community like that, then a program that would provide primary care would be successful.